The study of inflammatory markers in hypoxic COVID-19 patients and correlation with the disease severity. Coming to the introduction, coronavirus disease is causing severe acute respiratory syndrome, rapidly evolving into a global pandemic, affecting the individuals worldwide. Although primarily it was documented as a respiratory tract infection, emerging researchers indicate that COVID-19 causes and illnesses, which has a wide variety of clinical features ranging from mild to moderate upper respiratory tract infection to severe systemic disease, which involves respiratory as well as other body systems, including cardiovascular, gastrointestinal, neurological, immunological, and hematopoietic system. As the number of COVID-19 patients is dramatically increased worldwide and treatment in the intensive care units has been a major challenge. Early recognition of severe forms of COVID-19 is absolutely essential for timely triaging of the patients. Hematological abnormalities in COVID-19 are related with disease progression, severity, and mortality. NLR ratio is a prominent predictor of disease severity in COVID-19, and levels above the 9 determine poor prognosis and high mortality within the patients of ICU. C-reactive protein is also an acute phase reactant, which was significantly raised during the sepsis, as well as pro-inflammatory markers, which is induced by COVID-19, induced inflammatory cytokines. Ferritin is an important acute phase reactant linked with release of cytokines, which are responsible for cytokine storm in COVID-19. D-dimer is a measure of coagulation cascade, and in a way acts as severity and risk for patient to develop sepsis and septic shock. Lymphopenia, thrombocytopenia, abnormal coagulation profile, and sepsis leading to DIC is very well documented in patients of COVID-19. Based on the pro-inflammatory markers effects of all the above mentioned markers, and see how the main immunopathological of COVID-19 is a cytokine storm, we decided to investigate their roles as effective prognostic biomarkers for the disease and can provide a better guide for prompt management of patients, thus can help in decreasing the disease mortality and morbidity. My aims and objectives are to correlate the inflammatory markers with the degree of hypoxemia and to determine the inflammatory markers useful in predicting the disease severity. Coming to the methods, this study was conducted as a single-center prospective observational study and included patients who were diagnosed as COVID-19 positive via nasopharyngeal or oropharyngeal swab for RT-PCR. The study was carried out in a tertiary care hospital in the month of May 2021, and the study included 296 patients of COVID-19 admitted. And the data was pooled from 320 patients who were admitted in Dr. Patients and RF, out of which 24 were excluded as they were died within the 24 hours of admission. 296 COVID-19 patients requiring O2 therapy were divided into supplemental O2 and non-invasive ventilation groups of 149 and 147 patients respectively. These are the enrollment of the patients. Out of 320, 24 were excluded because they died within 24 hours. Out of 296, 149 were requiring supplemental O2 and 147 were requiring NIV. And demographic characteristics are described in table 1. In supplemental O2 groups, males were 59.4% and females were 40.9%. In NIV group, males were 59% and females were 40.8%. Out of 296 patients, 16.1 were patients less than 40 years of age, and 66.4 were patients between 40 to 60 years of age, and 16.7 patients were aged more than 60 years approximately in both the groups. And the inflammatory markers were studied in both the groups. Mean CRP was 61.3 in NIV group and 101.4 in SpO2 group with p-value 1.55, which is not significant. Mean ferritin was 572 in NIV group, 473 in SpO2 group with a p-value of 1.61, which is not significant. Mean D-dimer was 1175 in NIV group and 701 in SpO2 group with a p-value of 0.001, which is significant. And mean NLR was 11.19 in NIV and 8.5 in SpO2 group with p-value 0.12, which is significant. These are the demographic characteristics of the patients. Patients on NIV were 147 and SpO2 were 149. Out of them, male were 88 in NIV, 89 in SpO2, female were 59 and 60, and age less than 40 years, 40 to 60 years, and more than 60 years were similar in both NIV and SpO2 groups. And these are the pie charts representing the male and female population and age group population. And these are the bar diagrams showing CRP in NIV group and SpO2 group. And these are the ferritin levels showing in ICU group and non-ICU group. And this is a bar diagram showing D-dimer values in a NIV group and the supplemental O2 group. And this is the NLR ratio showing in NIV group and SuO2 group. Conclusion, we studied the effect of various inflammatory markers on hypoxemia and prognosis in COVID-19. Our findings can help in the treatment, effective management, and risk stratifying strategies of COVID-19 patients. The results from our study concluded that inflammatory markers, especially D-dimer and NLR ratio are the good predictors of degree of hypoxemia and disease severity. And these markers also predict the adequacy of the treatment or require escalation of the doses, hence useful in predicting the prognosis of moderate and severely ill COVID-19 patients. And we could not establish significant associations of serum ferritin and CRP in predicting the severity of COVID-19 associated with hypoxemia.